Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about upper respiratory tract infections. Upper respiratory tract infections are viral infections that infects the respiratory tract. We're going to talk mostly about two of these guys, influenza A and RSV. But there's a whole lot more. Just to give you an idea, there's a human metapneumovirus, adenovirus, parainfluenzae, rhinovirus, and coronavirus. So there's a ton. And you don't need to remember those names, but just know that there's a lot. So what are these viruses generally do? Well, we already said that they infect the respiratory tract. And based on that, we can actually pretty much figure out what kind of clinical presentations they can have. So starting from the top, they can have the infections of the nasal cavity. And so that will give you rhinitis or inflammations of the nose. They can also infect the pharynx, which is back here, and that will give you pharyngitis. And they can infect the larynx, which is right here, and that will give you the laryngitis. Now, if you notice, all of this kind is in the upper part of the respiratory tract. So we actually refer to an infections that affects this part as an upper respiratory tract infections. And the symptoms are going to be things that you'll be familiar with because we've all had these infections many times, like runny nose and coughing and sore throat. But actually, respiratory viral infections are not always so mild. And actually, they kill up to 4 million people a year. And they don't do it by giving you a runny nose, a cough, and a sore throat. So how do they do it? Well, by giving you a lower respiratory tract infections. And the first example of that is something we call croup. Now, what is a croup? A croup is when you get infections down here in the trachea. Sometimes also the bronchi and the larynx, and that infections make the walls of the trachea as well. Because they swell, it becomes difficult for air to get through and down into the lungs. Now, croup happens mostly in little kids. Now, when they have it, you can hear them actually have difficulty in breathing. And that sounds were referred to as a stridor. Now, what other more severe infections can you get? Well, if you get infections in these very small airways, deep in the lungs, these are called bronchioles. And so when you get infections, these are called the bronchiolitis. Now, just like croup, this makes it difficult for air to get down to the alveoli, which we'll draw here. And the last kind of infections you can get is actually when those alveoli themselves are infected. And that is called pneumonia. You're probably used to thinking of pneumonia as a bacterial thing, but you can get viral pneumonia too. So as we were saying, all of these are examples of lower respiratory tract infections. And the important thing about those is that in addition to all other kinds of symptoms, they can cause respiratory failures. These are the main ways that viruses infect the respiratory tract. But there's a few more things that we should mention. The first is that what do we have up here? Well, up here we have eyes, hopefully. And the eyes are actually lined up by the mucous membranes, and it turns out that a lot of the viruses infect the respiratory tract infections can also infect mucous membranes of the eyes. And there they give you conjunctivitis. And the very last thing we need to talk about is the viral infections that can actually cause bacterial infections. This is sometimes that we call bacterial superinfections. And the reason that happens is that the virus damages the host defense and makes it most susceptible to bacteria. And in particular, we have something called mucociliary escalator. It just refers to the fact that there are tons of little cilia that line most of our respiratory tract infections, which are constantly carrying mucus plus bacteria. And whatever else happens to be there out of the alveoli, out of the lungs, and up to the upper airway, where you can cough that stuff out or swallow it. So normally, bacteria are quite literally lifted out of the lungs. When you get a viral infections, the viral infections can actually damage the mucociliary escalator and therefore allow bacteria to hang out down here in the alveoli and replicate and give you a bacterial infection. And the reason this is called a superinfection is not because it's a super powerful, but because super means on top of. So it's bacterial infections on top of a viral infection. So you know a little bit of how respiratory viral infections present. And let's talk briefly about how you actually make a diagnosis. So I hope that the first thing that comes in your mind is clinically make the diagnosis based on the symptoms of all the conditions that were described here. But let's say you make a diagnosis of viral respiratory tract infections. How do you know which virus it is? Well, first answer to that is if it's an upper respiratory tract infections, it's just like a mild cold. Do you really need to know which virus it is? The answer is you don't need to know, especially because we don't have treatments for the vast majority of them. But if it's a lower respiratory tract infections, especially if it's someone who's hospitalized really young or immunocompromised, then it's a lot more serious. And in that case, we probably do want to know exactly what virus is causing it. Because that way, we can be sure that we know we're dealing with the virus. And also because that way, we know what kind of isolations we should use for the patients to make sure that they don't give the virus to someone else. So to find out exactly which virus we're dealing with, what we do is we take a little swab, a little sample of saliva from the pharynx, and we send it for respiratory PCR panel. What is this? Well, you probably know that the PCR detects generic materials, and so that the rest of the PCR panel actually looks for the RNA or the DNA of the whole bunch of viruses at once. And actually, it's the most RNA because most respiratory viruses are RNA viruses.